Hello everyone, greetings from Kalpana Eye Care Hospital, Chennai. I am Dr. Kalpana Suresh, Chief Ophthalmic Surgeon speaking. Today we are going to see about an important cause of preventable blindness in children, that is lazy eye or amblyopia. What is a lazy eye? Normally when we see an object, two images are formed, one by the right eye, one by the left. These two images are fused in the brain and we see it as one. If one eye does not develop, the image formed will be blurred. The brain cannot fuse that image. It will start ignoring the image, resulting in vision problem in that eye. This is called amblyopia or lazy eye. It begins during childhood. In most cases, only one eye is affected. 1 in 100 children suffer from this condition in India. It's called lazy eye because the stronger eye works better. However, people with amblyopia are not lazy and they cannot control the way their eyes work. Let's see why it happens. There are three causes. First one, if the eyes are not straight, as in squint, the image from the squinted or deviated eye will be blurred. Something is blocking the light entering the eye. It can be a droopy eyelid or cataractous lens. This is the second cause. In both the above conditions, eyes look abnormal and the parents would definitely take the child for eye testing. Most important third cause is with normal looking eyes, that is having a glass number or refractive error. It can be a short sight, long sight or cylindrical power. Power can be unequal in both eyes. One eye can be normal, other eye will have a high power. It is a most common cause and very easily missed if the other eye is absolutely normal. So how do you suspect? If the eyes are crossed, you have to suspect. If the child resists or cries if one eye is covered. Do this when the child is engaged in some interesting activity like watching TV. When you cover the bad eye or lazy eye, child won't bother because the child can see very well with the good eye. When you cover the good eye, child's vision will be blurred and he or she will resist or cry. Who are all at risk? Preterm and low birth weight babies, any family member with lazy eye, cataract, squint or glasses are at risk. What is the treatment? It includes treating the causes like refractive error, prescribing glasses for it, surgery for squint, cataract or droopy eyelids if any. Mainstay of treatment is getting the lazy eyes work by improving the nerve connections between the eye and the brain. For this, the good eye has to be patched. This will force the brain to use the image formed by the lazy eye. Eventually, vision will improve. Patching may be required for several hours each day or even all day long and may continue for weeks or months. It depends on how severe the problem is. The child has to wear glasses and perform some vision stimulating tasks. It can be reading, writing, doing homework, painting, drawing, crafts, board games, depending on the age of the child. At first, your child will have a hard time seeing. It's extremely a painful task for the parents to patch the eye and sustain it. Earlier the treatment is started, better is the outcome. 8 years is said to be the critical period, but now even older children and adults can also benefit from amblyopia treatment using computer programs that stimulate the neural changes leading to improvement in visual acuity. Remember, amblyopia will not go away on its own and untreated lazy eye can lead to permanent visual problem. If later in life the child's stronger eye develops disease or is injured, he or she will depend on the poor vision of the amblyopic eye, so it's better to treat the amblyopia early on. How to prevent this? Early detection. Even if your child appears normal, it's mandatory to get the eyes tested before the child joins school around 3 years. If suspected, earlier itself. Good vision is the key to a child's physical development, success in school and overall well-being. Hope this information on lazy eyes is useful to you all. If you have any queries, please post them in the comment box. I would be happy to answer. To watch more educative videos like this, kindly subscribe to Kalpana Eye Care YouTube channel. Thank you. Have a wonderful day.